Good morning. We are going to be doing a change of shift report for Mr. Smith in room 102. The situation is he's a 79-year-old male admitted with congestive heart failure secondary to hypertension. The patient has bilateral crackles and denies any loss of consciousness, but he does appear anxious and he has shortness of breath on exertion. He is in a full code with a cardiac diet and daily weights. He appears to have no GI or neuro issues at this time. His background is that he was admitted 4 days ago to the CCU because of his high blood pressure and shortness of breath. He isn't on any cardiac medications, which needs to be implemented immediately because of his high blood pressure and his pitting edema. The assessment is that the patient is alert and orientated, but he does present with lethargy, confusion, and generalized weakness. His chief complaint was shortness of breath on exertion. He does mention he is feeling a little bit better since he had a full balanced meal since being admitted to this unit. His vital signs are temperature of 97.6, a respiratory rate of 22, his heart rate is 69, weak and thready, which matches up with his congestive heart failure. His blood pressure is high, it's 170 over 110, and his oxygen is low, 89%, unclear sounds and his crackles. And irregular heart sounds are heard, S3 and S4. We are waiting to hear back on his ABG, ECG, and a chest x-ray as well. I would recommend some Lasix for his edema. It is 3+ at this time. Lisinopril for his high blood pressure, which is very high, and cardiac glycoside to help with his congestive heart failure. We would want to also monitor with a 12 lead. Elevate his legs for his edema. He was admitted with no specific diet, so definitely order a nutrition consult for a cardiac diet and low sodium diet. Telemetry for his heart. We don't want to do any IV saline because it's going to contradict his edema. And then for any pain, morphine, PRN. And if he is taking that, I would also do Colace for any type of constipation he might have because of that pain medication. Continue to monitor his vital signs and cardiac output. Place him on a 2-liter nasal cannula for his oxygen levels as well. And that's all I have to say about Mr. Smith. Good luck.